Now we look at pathophysiology, and you find in the initial phase, in the initial phase, there is viremia, and and with viremia there is, as I've said, immune response, and because of which there is continuous fever. Fever is very high. We have seen fever 104 to 107, and this lasts for 3 to 4 days. And in number of cases we find that there is a transitory type of nodules that develop on the skin, and then after 3 to 4 days fever subsides, even if you don't give any treatment, and the nodules also subside. So these are about 70 cases, and in this stage there is lacrimation, lymphadenopathy, and mild skin lesions. So this is the stage where we say that you should have bare minimum medicinal intervention, and allow full-fledged immune response to happen from the animal body side, so that it recovers fast. Now in this stage the biomarkers are fever, and then another biomarker which we have looked at is the calcium reactive protein, CRP. Now basically CRP is an inflammation response, in inflammation responding marker, and uh, this will be as there is infection and inflammation, the level will go up. So we have found that in the first stage, the CRP level is less than 100 microgram per ml. So we suggested to our vets to get in touch with different laboratories. Those were also medical laboratories, and we told them that the only thing which you need to do is take out blood and find out what is the CRP level, and if CRP level is less than 100 microgram per ml, don't worry. If the fever is very high, and if there is any problem, you have to only minimally you have to interfere by giving certain medications. Now in the ICF phase, what we generally see is pulmonary edema. Then there is very severe inflammation, and there are coagulopathies, and because of these coagulopathies you see lumps developing, lumps of thrombus developing at different parts of the body, especially on the on the terminal part of the body. For example, legs and the ear and the head are the one which are mostly affected. You have lumps of blood clots which will happen, and then fibrinolytic syndrome, because of which animal might go into bleeding and other kind of complications. And here we have suggested biomarkers to be calcium reactive protein more than 200 microgram per ml, and then to find out whether there is coagulopathy. We suggested a test which is very commonly done in human. It's called D-dimer, and this is available in any good human pathology laboratory. And we say that if D-dimer level is more between 200 to 500 nanogram per ml, then you have to think of intervention, because here the coagulopathy might result into different complication, and animal might die. Whereas the fibrinogen level between 5 to 7 milligram per ml of plasma, if that is the level, then exceeding that, then you'll have to think that there is a fibrinolytic syndrome. So this is what we suggested to them in protocol, that in the once the case comes to you, and when you find that it is in initial phase, and the farmer says that there is a fever since last 2, 3, 4 days, so just wait for another 2 days. If you find there are skin lesions, then you can just collect the blood sample, send it for CRP, and if CRP level is less than 100 microgram per ml, don't do anything. And if it is more than 100 microgram per ml, then maybe you can give some medicinal intervention, whereas other biomarkers can be done, and you can find out at what stage a particular animal is, and the treatment which has been suggested can be carried out. Next, please.